Fat Docs Talk. What's a DO? My name is Dr. Cindy Agu.
I'm Dr. Elizabeth Johnson.
I'm Dr. Jermaine Hofstrom.
And I'm Dr. Jeremy Hofstrom.
Let's get chatting.
So guys, what's a DO and what really makes it different from an MD? An osteopathic physician is what a DO is, and an MD is an allopathic physician.
Right, so looking back at the history of it, or I guess I should start and say that in today's practice, there's not a whole lot of difference in DO versus MD. But looking at the history of how osteopathic medicine came about, there were some differences back in the day, I would say. And so it all kind of started in the late 1800s with Dr. Andrew Taylor Steele, who was actually an MD at that time. And at that time, he felt as if that the practice was more so insufficient or not, that it could be improved. And so he had, his way of thinking was that if we incorporate the thought process that the body is more of a unit, that all of the body's systems work together to, as one, for the better health of the patient, that you would have overall better patient outcomes.
Like my colleagues have already said, there's really not much of a difference. It's just that we have an extra tool in our toolbox. But let's talk about a little bit about the philosophy of an osteopathic physician or osteopathic medicine.
So there are four philosophies of the osteopathic physician or osteopathic medicine.
So the body is a unit. The person is a unit of the body, mind, and spirit. Number two, the body is capable of self-regulation, self-healing, and health maintenance. Number three, the structure and function are reciprocally interrelated. And number four, that rational treatment is based upon an understanding of the basic principles of body unity, self-regulation, and the interrelationship of structure and function.
Whew, that's a lot of words.
Wow. Mouthful.
Impressive.
So I just want to let you guys all know that we are actually all DOs. I went to medical school in New York.
I went to school in Philadelphia College of Osteopathic Medicine.
Oh yeah, I went to Toro Crown.
Yeah.
In New York.
And we went to Edward Via College of Osteopathic Medicine in Auburn, Alabama.
Yeah, what the original one was based in Virginia.
Which is really cool. So why did you guys get into osteopathic medicine versus allopathic medicine?
To be honest, the first time I heard about a DO, I did not know what a DO was at all. I happened to go to an open house with a friend at the time, and that's how I learned about osteopathic physician. And especially when I found out there was no difference in terms of what an osteopath versus an allopathic doctor could do, I decided, you know what, I like looking at the person from a whole picture, and I want to learn how to approach my future patients that way too. So I went to a DO school.
Yeah, so I also too, like I didn't know what a DO was until like later on in my undergraduate career. But when I did find out about what a DO was, I did like the philosophy that the body was self-regulating and self-healing, and I like that the body can, you know, heal itself. Basically, you kind of just have to help it, like just a little bit.
Yeah, and similar here, I really didn't know, or actually hadn't heard of ADO until actually when I was volunteering at the hospital. And then that's when I found out that I would see people walking around that had DO on their badge instead of MD. So then I went and had to research and find out what this DO thing meant. Then I was like, oh, it means osteopathic medicine. So then I was like, okay, what is that? So then I had to kind of look that up. And then interestingly enough, I ran across a physician. He was a radiologist, I'm sorry, he was a pathologist, and he was actually a DO. So we shadowed him for a period of time, and then I kind of started to ask him, like, you know, what made him go into this field? And then that's when he kind of told me that he was very interested in kind of the concept of what osteopathic medicine was, and how it applies to, you know, looking at the person as a whole.
Yeah, and same for me. You know, I didn't really know about the field of osteopathic medicine until about my second year of undergrad. And so at that time, it was kind of similar. They had a couple of medical schools come in, and one was osteopathic school. And I had no idea what they were talking about. I was like, okay, osteopathic. First of all, I didn't know that there was even a difference, and so I didn't even notice that difference until they pointed it out to me. And similar, you know, I've learned that along the way that they are in all the same fields as allopathic, MD physicians are in. And even after learning that, as I started to work in the hospital and volunteer more, I kind of opened my eyes more, and I started to realize, I started looking at the badge names, the degree, just to kind of see, you know, who all is it, MD versus DO. And I started to realize DO physicians were like actually all over the place. It wasn't like necessarily like I would say lacking in any way, but I started to see that they were literally all over the place, and everywhere from surgery to radiology to cardiology to primary care as well. And so from then I was like, oh, okay, so this is just something that I had like no idea about, but it was sitting right in front of me the whole time, literally the whole time. And after, for me, understanding more about it, and similar to what Liz said, I definitely like, you know, the philosophy behind it, and I definitely agree with it. So I'm definitely excited to be in this field and, you know, to be practicing this.
And in the United States, there's only 2 recognized physicians. That's an osteopathic physician, a DO, and an MD, which is an allopathic physician, like I said earlier. So there's only 2 recognized physicians. I don't know if he said that earlier, but.
Yeah. So Dr. Johnson did mention that we have like an extra tool in our toolbox when we become DOs. So the extra tool that we have in our toolbox is OMM or OMT. And that actually stands for
Osteopathic Manipulative Medicine or Osteopathic Manipulative Treatment.
So basically, what is that?
Well, I have to also say, in terms of if there are any students watching this and you're interested in getting into medicine, you know, at a DO school, you're taking all of the same courses that you would be taking at an allopathic school or an MD school. It's just that you're taking one extra class over those 4 years, and that's the OMT or OMM courses. So I just wanted to say that before we get into it. But I know that we have all mentioned this several times, that DOs or osteopathic medicine are taking more of a holistic approach. So this extra tool that we have in our toolbox helps us really to focus on how, like I said earlier, the body is a unit, and how we can help by focusing on the structure and function to really help with healing. So that's my interpretation of it. Maybe an oversimplification, but
it focuses on, you know, how the systems of the body are pretty much all connected, and how, you know, dysfunctions in these systems can manifest as musculoskeletal dysfunctions. So that's kind of what we kind of help with that.
Right. So it's a hands-on approach where we literally are manipulating different structures, like whether it's you know, muscle energy that we're doing, whether there's a tool called HVLA, that's high velocity, low amplitude technique. So whether you're manipulating the spine, all to help with your body healing itself. OMT is not the same as what a chiropractor is practicing. Just want to make sure we clarify and make that distinction.
Right, and so like there are a lot of different techniques, like Dr. Johnson said. So my absolute favorite technique is a technique that we use to help with constipation. I actually fell in love with this technique when I was doing a medical mission trip in the Dominican Republic. And actually one of the patients was complaining because she had like a really hard time like going to the bathroom. So I did this manipulation technique on her, and then, you know, she kind of went about her day. And a couple hours later, into our clinic, she came back so happy because she just had the biggest stool. She had the biggest smile on her face. I was like, oh my gosh, I'm so happy it worked on you, and I'm so glad that you were that excited that you had to come back to the clinic and let me know that it actually worked.
So that's a great segue into what can OMT really be helpful with? Like, what are some of the things that you would see in your practice that we can use OMT for?
Yeah, so for me, obviously, one of my favorite ones is one that is commonly used, especially if you have like a sinus infection or a cold, right? So whenever you get sick in general, your lymphatic system is kind of helpful, responsible for sort of clearing out the bacteria and things like that. And so it's a technique that you can use like across the face and just in general throughout the rest of the body. You're just kind of like applying pressure through different parts of the body to get that lymphatic fluid to kind of continue to be pumped through so that it can essentially clear itself via like the bowel and things like that. And so it basically helps to speed up the process of the recovery from illness. So no, it's not like a voodoo magic or anything like that. You know, it's a realistic maneuver that again helps to physically push the fluid through. Kind of similar to if somebody had, let's say, a heart condition, so they might happen to have a lot of swelling in their legs, and you recommend that they elevate their legs for the fluid to drain back to the heart. So similar thing, that same mechanism, you're helping to sort of speed that up just with physical techniques. So that's kind of a way that one thing that I love to do a lot.
In my case, I'm a pediatrician, so it's very helpful in the office when little ones have ear infections. Very often, you know, when they have ear infections, they have fluid that's building up behind the eardrum, which can be very uncomfortable and painful. So, you know, OMT gives me an extra tool or technique that I can use to relieve some of that pressure, on top of course, with antibiotics.
A technique that I really do like to use is called Suboxone Release. So that one for me is really good as far as treating patients that have headaches. I remember one time during med school, I used it on a patient, and she was actually really happy. You know, I turned out the lights in the room, then I laid her back on the table.
Set the mood for the field.
And then I kind of did a release, and so basically it's helping to kind of relax the muscles on the back of your head. And then she was so great. She was even asking when she could actually come back and have it done again. So it really is.
Yeah, there's a lot of different techniques that do help with headaches, which is like a major complaint in the field of pediatrics and also in adult medicine.
Like we said earlier, there aren't any barriers for osteopathic physicians. You can find them in any specialties. So what are you guys in right now? What specialties do you practice?
So I'm in internal medicine, actually.
Internal as well.
Mm-hmm. Pediatrics, specifically neonatology.
And I am a general outpatient pediatrician.
Yeah. So we do know, like we said, every field there's a DO, whether it be OB, surgery, ortho, sports medicine, family medicine. So DOs are able to do all fields of medicine. Psychiatry. So yeah.
Yeah, just within our own medical school class, there was people went into like literally all fields. I mean, radiology and you know, as deep as you want to go, as fancy as you want to go.
Anesthesia.
Anesthesia.
Critical care.
Critical
all
care.
Different sorts of things. So
for anybody that is interested in becoming a DO in the future, there are several DO schools around the country. There are approximately about 30 of them. And there are over 100,000 DOs who are actually practicing medicine throughout the country. And of course, there will be more.
So look out for your local DO if you're looking for a more holistic approach, an integrative approach to medicine. And I think that's about it.
That's about it.
All right.
Yeah.
Thanks for watching.
We had fun. Make sure you like, comment, subscribe.
And follow us on Instagram at Young Black Physicians
Yes.
and Facebook as well at Young Black Physicians.
Facebook and Instagram. Thanks, guys.
Bye.